Hello, this is the podcast for San Francisco PDA student chapter with me, Nick Kapp, the student club advisor. This is the Mask Podcast. I will take this off. Are we seeing the development of a new regulation here? Part of the PDA is looking at regulations, so I think this is a very exciting time for us, which we can see new regulations that are popping up as to opposed to the mask wearing. Remember, the tagline for the Peritoneal Drug Association is connecting people, science, and regulation. You know, we're still learning. A growing body of evidence supports the idea that wearing face masks in public, even when you feel well, can help curb the spread of coronavirus. Since people can spread the virus even without showing symptoms, that's the main reason to wear a mask in public, to protect other people from you. The World Health Organizations, the Centers for Disease Control, and even NPR, all National Public Radio, all published ways and whys we should wear masks recently. Bill Nye, the science guy, even talked about why you should consider wearing face masks. More and more places are making requirements for wearing a mask in public. And again, is this going to become a regulatory thing? It seems like as of the 10th of this month, about 21 states have a requirement for wearing masks in public. And so government regulation refers to the implementation of rules by government agencies that is backed up by law. So that probably means you can either get a fine or a prison term if you don't follow that regulation. The employment of legal instruments for the implementation of social or economic policy objectives. And so basically what we're looking at in a regulation is something that's either good for our economy or good for our society. Regulations are intended to keep us safe and to level the playing field with manufacturers. And so if somebody doesn't wear a mask and they have an unfair advantage over people who wear the mask, then people aren't going to wear the mask. And so what you may see is more and more people wear masks because it's not only a good idea, it's a requirement. This is like the Pure Food and Drug Act, which is going to be one of our next podcasts. Basically in 1906, people came together and said, you know what, we need to regulate this stuff. We need to regulate foods. We need to regulate drugs. All masks are not created equal. The cloth mask is actually an air diverter. Anything that covers the face that has a tight weave is basically preventing our breath from going straight out there, and it's diffusing it. It's also collecting aerosols so that they don't come out. These cloth masks aren't regulated by the FDA or any other governmental body. Some of them are better than others. Some people wear ski masks, which you can basically spit through, and some wear actually cloth masks that have several layers in them that are quite good. The surgical masks that you've seen, some of these pass requirements, but the FDA, but most do not. In general, surgical masks are regulated under the CFR, the Code of Federal Regulations 21-878.4040. They are basically meant to block large particle droplets, splashes, sprays, or splatter that may contain germs. And so you would wear them, typically before we would wear them in surgery. The N95s are more of a respiratory protective device. NIOSH, if you look at your N95s, they need to have a NIOSH logo on those in order to be protective. They need to achieve a very close facial fit and have a very efficient filtration of airborne particles. From a National Geographic article, regardless of whether you choose a cloth or surgical mask, be aware that does not mean you can suddenly be in prolonged close contact with others. These masks might buy you a few extra minutes of protection, but not hours and not for lengthy periods of time. Now, there is some pushback on people not wearing masks, and this is some information that I got from MarketWatch.com. Basically, the president's reluctant to wear masks in public, and so why should I wear a mask if that? We rarely wore a mask in public, do not want to admit that this is kind of the new normal. You want things to be how they were, and this is not normal. Men are less likely to wear a mask. It's a sign of weakness, or, sign that you don't care, I guess. People with higher earnings are more likely to wear a mask. 80% of New York and Los Angeles wears a mask, 60% outside of those areas. So there are different people don't wear masks for a different reason. But like any regulation, there's a number of people who don't want to do it, whether it's not convenient, whether it's not what you've done before, that's not what you can do. This is the Surgeon General here, and our Surgeon General actually gave a nice little talk talking about the change of the mask policy. And so for a long time, we have not recommended doing the mask, but we're learning. This is probably a bad thing in that before this, we used to laugh at people who wore masks. When this event was first happening, I would see people with a mask and I would laugh at them. When we did this, we thought that social distancing would be better, that if you're far enough away from somebody, aerosolized or airborne or aerosolized. Airborne basically means the germs are in the air and they're kind of floating around, they can go a lot. And aerosolized, they're part of an aerosol, they're part of a larger particle. If you breathe it out after a couple of meters, it kind of just falls to the ground. And so the idea was that when you were 6, 7, 8, 10 feet away from people that you're not going to be exposed to this, but you don't need a mask. What we also seen is that before with diseases like this, you had to have symptoms in order to spread disease. Well, what we're finding out now is that people who don't have the symptoms can be spreading the disease before they develop the symptoms. When you wear a mask, it's protecting me and it's protecting you. Both of us together are protecting one another when we wear masks. And the president is tested every day, so he doesn't have to wear a mask, but even then, people are convincing him, and he has started to wear a mask in public. The World Health Organization is advising us on using masks. National Geographic had a great article on how to make a mask that everyone will wear, and so if it's fashionable, you'll probably wear it, and it works as well. Mask wearing is getting normal. As the numbers rise, wearing a mask is going to be part of our normal everyday life. That's it for today's talk. Make a connection, encourage someone to wear a mask. The science is evolving, and we did not discover masks. Masks aren't new, but our concept of why we should wear a mask. When we originally did this science, coronaviruses before didn't transfer unless you showed symptoms. It hasn't really changed. In the past, people would recommend people wearing a mask when they had symptoms, but now it's like we don't have symptoms. Also, cloth mask is different than a surgical mask, which is different than an N95. The N95s and the surgical masks are in relatively short supply, and we need to save those for our first responders. The cloth masks that we have would go a long way towards helping us, and if we're not in our houses practicing social distances, the masks are that, but they're not perfect. Again, this is a new regulation. Are we going to follow it? Who knows?